is a condition where you have primarily motor or movement problems that come from an injury to the immature or very young brain, and it's non-progressive. One of the most important factors about CP is that it is very, very broad. You can have kids with very mild CP, or you can have kids with very severe CP. And on the mild end, it may be just a little bit of difficulty with walking. Maybe a person walks slightly on their toes. On the very severe end, on the other hand, you can have somebody that can't talk, can't walk, can't eat without a tube. And then there's all the cases in between. Prematurity. If a baby is born very prematurely and is very small, and I've seen babies that weigh as much as, or as little as just 1 pound, the chance of cerebral palsy is much greater, and that's because the brain is not developed, and you get areas of the brain that don't get enough oxygen, that have bleeding, and then that leads to that brain injury that causes the cerebral palsy. We call it CP even when a child has a brain injury from something else, like maybe a car accident, within the first couple years of life. And that's because the very young brain reacts differently to injury than the older brain. If an older person has a stroke or is in a car accident, the body functioning is gonna look somewhat different. So the key things are a number of different causes, and one of the things that's important about CP too is that we don't, in a lot of cases, we don't know the cause. Maybe it was an infection in utero, or just some unknown congenital something, and that often, one of the key issues about that is that can lead parents to feel guilty, like they've done something to cause the CP, and so it's really important to let people know that they didn't cause the CP, that sometimes these things just happen.
Nice. Okay, now switch and try to throw right.
But he doesn't sit or crawl or walk or any of the things that a normal 2-year-old would do. He does eat food by mouth, but it's baby food.
Okay.
So we have to feed him.
Is he on a blended diet?
Yeah, it's all soft diet.
Okay. So what was Andy diagnosed with?
Congenital CMV, which is a virus that, as most kids get, is just like a cold, but to a fetus it's very damaging. So I got it early on in my pregnancy, and it caused her brain to develop abnormally.
So is this considered mild, moderate, or severe?
She's severe.
Okay. Does this diagnosis cause her physical pain?
The tight muscles make her uncomfortable. You can tell when she sleeps or she wakes from a sleep that she's tight and hurting, but I don't think she's constantly in pain.
And what does her diagnosis affect daily?
Everything. Anything you can think of for the normal activities of daily living. She can't sit, she can't roll, she can't talk, she doesn't eat by mouth. So everything is, she's 100% dependent in every aspect.
So she has a feeding tube.
She does, she has a button.
And what daily activities does this affect?
Just walking and balancing, really.
Yeah.
Sometimes it causes her pain. She has very tight joints, tight muscles. Has to do a lot of stretching. She also earlier in life, when she was first born, she had to be put on a medication called baclofen because she was in so much pain she would cry all day. It affects pretty much everything. She is almost non-ambulatory, so I would call it quasi-ambulatory, which means that she can get from place to place, but she has to be in a gait trainer. She can't turn yet. She can flip over. She has a very difficult time grasping things. Yes, they do. What I've noticed is that there are good things and there are bad things about how people treat her differently. The good is that the younger people, they're more prone to embrace her, and along with her condition, and they're more willing to help. Whereas older people, adults, are very standoffish. They want to shy away, kind of ignore the whole thing and ignore Lily.
Yay, Lily! Kick him, kick him, kick him! Come here. Oh, good. Get him. Yay! Did you find him? Get him again. Get him again.
I could say I knew one boy who had cerebral palsy. Nobody thought he really understood, and when someone finally was able to help him adapt a device where he could type, he typed out sentences. And he was probably about 13 at the time.
What's your name?
Amelia.
And how old are you, Amelia?
Look at Emily.
How old are you?
3.
What were you diagnosed with, Amelia?
What do you have? Cerebral palsy.
And is it considered mild, moderate, or severe?
Probably moderate.
Moderate. Does the cerebral palsy ever make you hurt? What? No way? It doesn't hurt?
Your
Good.
muscles hurt sometimes.
Yeah.
Maybe your muscles get tight a little
Yeah.
bit, but she doesn't complain too much.
Said that these kids with CP or any disability really have amazing things to teach us as parents and friends, neighbors, family. And I think we just need to take that time to learn what it is.
Mostly that she's special, and she can only make your life better. And by treating her differently or not including her, you're making things worse for yourself, because she just exudes love, and no other child has special needs without special needs can bring that same spirit. She was so special. She decided to take this on and bring it to the world, and she can only make your life better for it. And it's not a disease, and it's not contagious, and she's just extra special.
Okay. That children are not their diagnosis.
That we should never underestimate and take for granted what we think kids and adults with cerebral palsy can and can't do. We should give them every benefit possible and help them to achieve their highest potential.